Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving nose first into a topic that many cat owners and veterinarians find both common and incredibly challenging: feline rhinitis. Specifically, we'll be focusing on the chronic form of this condition, an ailment that can cause significant distress for our feline friends and a great deal of frustration for the people who care for them. If you've ever lived with a cat that seems to have a permanent case of the sniffles, with a constantly runny nose and bouts of sneezing, then this episode is for you. We're going to explore what causes this persistent problem, how it's diagnosed, and the myriad of ways we can try to manage it. So, what exactly are we talking about when we say feline chronic rhinitis? The definition is quite straightforward. It's an inflammation of the nasal cavity that has been present for 4 weeks or longer, either happening intermittently or just never seeming to go away. Very often, the inflammation doesn't just stop at the nasal cavity. It can also involve the frontal sinuses. When that happens, veterinarians will often use the more specific term chronic rhinosinusitis. This condition is surprisingly common, accounting for about 35% of all feline rhinitis cases. In fact, after cancer, it stands as the second most frequent cause of chronic nasal discharge in cats. Despite how often we see it in practice, managing chronic rhinosinusitis can be a long and often frustrating journey for everyone involved, with cures being very rare. To truly understand this disease, we need to look at what's happening at a microscopic level, deep inside the delicate and complex structures of a cat's nose. The leading theory points to a 1-2 punch scenario, starting with a viral infection early in a cat's life. The main culprit is thought to be feline herpesvirus 1, the very same virus responsible for what many people call cat flu. This is an alpha herpesvirus that is epitheliotropic, meaning it targets epithelial cells, and it is cytopathic, which means it damages or kills the cells it infects. The virus enters the cat's body through the nose, mouth, or eyes and starts replicating in the nasal epithelium. From there, it can spread to the conjunctiva, pharynx, and even down into the trachea and bronchi. This initial, acute infection causes significant damage. It leads to necrosis, or cell death, of the mucosal epithelium, the delicate lining of the nasal passages, and even damages the underlying turbinate bones, which are the intricate, scroll-like structures inside the nose that help to warm and filter air. This initial viral assault is critical because it fundamentally alters the nasal environment. The damage to the turbinates is often permanent, creating a landscape that is predisposed to future problems. Now, here's where feline herpesvirus gets particularly tricky. Like other herpes viruses, it has the ability to establish a latent, or dormant, infection. After the acute illness resolves, the virus retreats along sensory nerves and takes up residence in the trigeminal ganglia, which are clusters of nerve cells. Once there, it can remain for the cat's entire life. In fact, almost all cats that recover from a feline herpesvirus infection become lifelong carriers. This latent virus can then be reactivated by stressors, things like moving to a new home, boarding, or even lactation in a mother cat, leading to periods of viral shedding and a potential recurrence of clinical signs, a process known as recrudescence. You might think then, that chronic rhinitis is simply a case of the herpesvirus flaring up again and again. But the story is more complex. Studies using sensitive polymerase chain reaction, or PCR, techniques have found feline herpesvirus 1 DNA in nasal biopsies from cats with chronic rhinosinusitis. However, they've also found it in samples from perfectly healthy cats. This suggests that the mere presence, or even reactivation of the virus might not be the whole story. Instead, it seems that the initial structural damage caused by the virus is the more critical factor, creating a compromised environment that allows other issues to take hold, particularly secondary bacterial infections and a potentially impaired or dysregulated immune response. The chronic rhinitis, therefore, isn't necessarily the virus itself causing ongoing disease, but rather the long-term consequence of the damage it left behind. This leads us to the second part of the 1-2 punch: secondary bacterial infections. With the nasal passages damaged and the local defense mechanisms compromised, bacteria that are normally present without causing any harm can move in and set up shop. Bacterial infections have been identified in a high percentage of chronic rhinitis cases, anywhere from 69 to 90%. However, it's believed that a primary bacterial infection, where bacteria are the initial cause of the rhinitis, is actually quite rare. More often than not, what we find is a mixed growth of commensal organisms, which are bacteria that are typically found in the oropharynx, or the back of the mouth and throat, in healthy cats. Some of the bacteria frequently isolated include Pastorella multicida, Staphylococcus pseudointermedius, Streptococcus viridans, and various anaerobes. The role of certain other bacteria, like Bordetella bronchoseptica and Mycoplasma species, is still a bit of a mystery. They are sometimes considered primary pathogens in acute respiratory disease, but their role in the chronic form is unclear. One study did find that Mycoplasma species were detected in cats with chronic rhinosinusitis, but not in healthy control cats, which suggests they might indeed play a part in this disease complex. A significant problem that arises from these recurrent bacterial infections is the frequent use of antibiotics. While a course of antibiotics might clear up the signs temporarily, the bacteria often return once the medication is stopped. Worse, repeated short courses of antibiotics can have an unintended consequence. They can wipe out the more susceptible bacteria, allowing more resistant organisms to flourish. One of the biggest offenders in this scenario is Pseudomonas aeruginosa, a bacterium that is notoriously resistant to many commonly used antibiotics. Its selection can make subsequent infections much more difficult to treat. While the herpesvirus and secondary bacteria theory is the most widely accepted, researchers have looked into other potential causes as well. In the past, retroviruses like feline leukemia virus, or FLV, were thought to be associated with chronic rhinosinusitis. One older study found that 55% of cats with the condition were positive for FLV. However, subsequent studies have shown a much lower prevalence, between 0 and 7%. This decline mirrors the overall drop in FLV infection in the general cat population since the introduction of an effective vaccine, suggesting the earlier association may have simply reflected the higher prevalence of the virus at the time. Other infectious agents have been investigated with less conclusive results. The role of Bartonella, the bacteria responsible for cat scratch disease in humans, was explored, but a study failed to find strong evidence supporting its involvement in chronic rhinosinusitis. More recently, a single case report identified the protozoan Tritrichomonas foetus in a cat with chronic rhinitis, but because Mycoplasma felis was also present, its significance remains uncertain. Then there's the question of allergies. In humans, allergic rhinitis is a huge cause of chronic nasal symptoms and is often linked with asthma. Could a similar situation exist in cats? The role of inhaled allergens in feline chronic rhinitis has not been extensively investigated, so it's possible that the prevalence of allergic rhinitis in the feline population is underestimated. This might be particularly true for cats that also show signs of asthma or conjunctivitis. A specific type of inflammation seen in some nasal biopsies is an eosinophilic infiltrate, which often points towards an allergic or parasitic cause, though this is unproven in cats. Interestingly, this type of inflammation has been seen in cats with rhinitis who also have asthma, which could support a role for allergy in at least some of these cases. Finally, there is a specific, though rare, diagnosis called feline lymphoplasmacytic rhinitis. This is a condition characterized by a particular type of inflammation dominated by lymphocytes and plasma cells, which can lead to progressive tissue destruction. Its exact cause is also unclear, but it's thought to involve a breakdown in the nasal mucosa's local defense mechanisms, leading to cycles of inflammation, damage, and repair that are independent of any active viral infection. So, what does a cat with chronic rhinitis look like to an owner? The history is often quite typical. The condition is usually identified in young to middle-aged cats, though a very wide age range can be affected, from 6 months to 16 years or even older. Many of these cats may have had a history of cat flu as a kitten, though this can often be difficult for an owner to confirm. The hallmark sign is recurrent episodes of nasal discharge. Initially, this discharge might be clear and watery, what we call serous. Over time, it often becomes thicker and mucus-like, or mucoid, and with secondary bacterial infections, it turns into a thick, opaque, yellowish or greenish mucopurulent discharge. The discharge can be on one side, or unilateral, on both sides, or bilateral, or it might start on one side and progress to become bilateral. Alongside the discharge, sneezing is a very common sign. Owners may also notice stertorous respiration, which is a fancy term for noisy breathing that sounds like snoring or snorting, caused by the obstruction in the nasal passages. These flare-ups are often associated with stressful events, like a stay at a boarding kennel, breeding, or even just a trip to the vet for neutering. During these episodes, cats often become inappetent, meaning they lose their appetite. This can happen for several reasons. They can't smell their food, which is a huge driver of appetite in cats. They may have difficulty breathing while trying to eat, or they may simply feel unwell and have a fever. As we mentioned, these episodes often seem to get better with a course of antibiotics, but frustratingly, the signs almost always return after the medication is finished. When a veterinarian examines a cat with these signs, they perform a complete physical but pay special attention to the head and face. They will assess nasal airflow, often by holding a cold microscope slide or a wisp of cotton wool in front of the nostrils to see if air is moving through both sides. Decreased airflow can be a sign of obstruction, possibly from a mass like a tumor or polyp, not just mucus. The vet will carefully characterize the nasal discharge, its nature and whether it's unilateral or bilateral. Unilateral discharge, for instance, is more commonly seen with a foreign body or a tumor than with chronic rhinosinusitis. They'll check for facial symmetry, as asymmetry can also be a red flag for something more sinister like a tumor or a severe fungal infection, although it can occasionally be seen with chronic rhinitis. Palpating the face and head might reveal pain, which tells the vet that analgesia, or pain relief, is needed. The eyes are also important. Conjunctivitis can be a clue to infection with organisms like feline herpesvirus 1 or Chlamydophila felis. The vet might use a fluorescein stain to check the patency of the nasolacrimal ducts, the little tubes that drain tears from the eyes into the nose. Chronic inflammation can cause these ducts to become blocked, leading to excessive tearing or epiphora. A thorough oral examination is crucial, but this almost always requires general anesthesia in a cat. The vet will look for things like a cleft palate, an oronasal fistula, a hole between the mouth and the nasal cavity, often from dental disease, or any masses. They will also visualize the nasopharynx, the area at the back of the throat above the soft palate, which can be done by retracting the soft palate with a small hook and using a dental mirror. An otic, or ear, examination is also part of the workup to look for signs of nasopharyngeal polyps, which can originate in the middle ear. Finally, the regional lymph nodes, specifically the submandibular nodes under the jaw, will be palpated. After the history and physical exam, the diagnostic journey begins in earnest. The diagnosis of chronic rhinosinusitis is largely one of exclusion, meaning the vet has to systematically rule out all the other possible causes of these clinical signs. The list of differential diagnoses is long and includes neoplasia, like lymphoma or adenocarcinoma, nasopharyngeal polyps, foreign bodies, like a blade of grass, fungal infections, such as Cryptococcus or Aspergillus, allergic rhinitis, dental disease, and congenital abnormalities, just to name a few. The investigation typically proceeds from the least invasive to the most invasive tests. It starts with routine laboratory analysis, hematology, biochemistry, and urinalysis. These blood and urine tests are usually nonspecific for rhinitis itself but provide vital information about the cat's overall health and are essential before putting the cat under general anesthesia. Testing for retroviruses like FLV and FIV is also recommended, not to diagnose the rhinitis, but to understand the cat's overall health status, which can affect the prognosis. As for serology, testing the blood for antibodies against respiratory viruses like feline herpesvirus or calicivirus, it is of no use for diagnosis. This is because seroprevalence, the percentage of cats with antibodies, is very high even in the healthy cat population due to natural infection and widespread vaccination. A positive result doesn't tell you if the virus is causing the current problem. Swabbing the nasal discharge for bacterial culture is also of minimal benefit. The swabs are likely to just pick up the normal commensal bacteria from the front of the nose and oropharynx, which may not be the organisms causing the deep-seated infection. To get a clearer picture, the next step is usually diagnostic imaging under general anesthesia. Radiographs, or X-rays, of the skull can be taken, but interpretation can be difficult due to the superimposition of all the complex bony structures. Findings consistent with chronic rhinitis might include soft tissue or fluid opacity in the nasal cavity and sinuses, with a blurring of the turbinate structures. However, both chronic rhinitis and neoplasia can cause erosion of the turbinate bones, making it impossible to get a definitive diagnosis from radiographs alone. For this reason, computed tomography, or a CT scan, is considered far superior to radiography for imaging the nasal cavity. CT provides a detailed, cross-sectional view of the nasal passages and sinuses, allowing for a much better assessment of turbinate destruction, fluid accumulation, and the presence of any masses. But even with the superior detail of CT, there can be an overlap in the appearance of inflammatory disease and neoplasia. Certain features, however, are more suggestive of cancer, such as lysis or destruction of specific bones like the vomer bone, or unilateral soft tissue opacification of the sinuses. While the cat is under anesthesia for imaging, other diagnostic procedures can be performed. A nasal flush is a common one. This can be both diagnostic and therapeutic. For a diagnostic flush, a small, sterile catheter is placed into the nasal cavity, and a small amount of sterile saline is gently flushed in and then aspirated back out. This fluid can then be submitted for aerobic and anaerobic bacterial culture, and potentially fungal culture or PCR testing for organisms like mycoplasma. A therapeutic flush is a more vigorous procedure designed to clear out the thick mucopurulent material that's clogging the passages. This can provide immediate relief by improving airflow, and can also help dislodge foreign bodies. The gold standard for getting a diagnosis, however, is to look directly at the tissues and take samples. This is done through endoscopy, also known as rhinoscopy. Using a small, rigid or flexible endoscope, the veterinarian can visualize the inside of the nasal cavity and the nasopharynx. In a healthy cat, the nasal mucosa should be pink and smooth, with blood vessels clearly visible. In a cat with chronic rhinitis, the vet might see congestion, redness, increased fragility, ulceration, and a lot of mucus. There might also be evidence of turbinate destruction, creating more open space within the nasal passages. Endoscopy allows for targeted sample collection. While a small cytology brush can be used to collect cells, this technique is rarely used because the samples are often not very cellular, and the correlation with the actual disease process is poor. The most important procedure is to obtain a nasal biopsy. Small pieces of tissue are taken using tiny biopsy cups, either through the endoscope or alongside it. It's crucial to take biopsies from both the right and left nasal cavities, as the appearance during endoscopy doesn't always correlate well with the microscopic findings. The biopsy samples are then submitted for histopathology, where a pathologist examines them under a microscope. The histopathology report is what ultimately confirms the diagnosis of chronic inflammatory rhinitis. It will describe the nature of the inflammatory infiltrate, classifying it based on the predominant cell type. Most commonly, the infiltrate is described as either neutrophilic, also called suppurative, or lymphoplasmacytic. Neutrophilic inflammation seems to be about twice as common and is associated with more severe inflammatory changes. These different patterns may simply reflect different stages of the same disease, or depend on whether a bacterial infection is active at the time of sampling. The pathologist will also report on other changes, such as epithelial ulceration, fibrosis, scarring, glandular hyperplasia, and turbinate destruction or remodeling. Once a diagnosis of chronic rhinosinusitis is made, the focus shifts to management. And this is where we must start by managing expectations. It's crucial for owners to understand that treatment for this condition is not curative. There is no definitive therapy that will make the problem go away forever. Instead, the goal of treatment is to control the episodes of clinical signs, to reduce their frequency, their severity, and their duration, and to prevent the disease from getting worse. It's a journey of management, not a quest for a cure. This often involves multimodal therapy, using several different approaches at once to address the different aspects of the disease. The cornerstone of managing flare-ups is often a long course of antibacterials to tackle the secondary bacterial infections. Ideally, the choice of antibiotics should be based on culture and sensitivity results taken from those deep nasal flush or biopsy samples. This tells the veterinarian exactly which bacteria are present, and which drugs will be effective against them. However, because this requires a general anesthetic each time, it's often not practical for every flare-up. As a result, vets often have to rely on empiric prescribing, choosing an antibiotic based on the bacteria most commonly identified in these cases. The chosen antibiotic should also have good penetration into bone and cartilage, since the infection is often deep-seated. Common choices include amoxicillin clavulinate, doxycycline, or fluoroquinolones like pradofloxacin. Because these are chronic, deep infections, treatment courses need to be long, typically for a period of 6 to 8 weeks. It's important to remember the Pseudomonas problem we discussed earlier. This bacterium is often resistant to these commonly used antibiotics, so if a cat isn't responding, a culture is essential to find an effective, and sometimes less common, antibiotic. Alongside antibiotics, a lot of supportive therapies are aimed at simply helping the cat breathe more easily by clearing out the thick, tenacious discharge. This is where therapeutic nasal flushing, performed under anesthesia, can provide significant clinical relief. It removes the mucopurulent material, which not only helps with breathing but can also relieve the pain associated with sinusitis. At home, owners can use nebulization. A nebulizer is a machine that turns a liquid, usually sterile saline, into a fine mist that the cat inhales. This helps to humidify the upper airways, making the secretions less viscous and easier to clear. A typical regimen might be a 15-minute session every 8 to 12 hours. If a hospital-grade nebulizer isn't available, an alternative is to place the cat in a steamy environment, like a bathroom with a hot shower running, for a short period. Using a standard home humidifier in the room where the cat spends most of its time can also be beneficial. Other medications are sometimes tried to improve airflow, though the evidence for their benefit is lacking. Mucolytics, such as bromexine, are drugs that are supposed to help break down mucus, but their primary action is in the lower airways, so their role in nasal disease is unknown. Decongestants, either as oral medications like pseudoephedrine or as topical nasal drops, can also be considered. They work by causing vasoconstriction, which reduces mucosal swelling and improves airflow. However, this is often followed by a rebound vasodilation that can make the signs worse, so topical use should be limited to just a few days. What about tackling the virus that started it all? The rationale for using antiviral therapy is based on the idea that flare-ups of rhinitis are linked to the reactivation of a chronic feline herpesvirus 1 infection. However, as we've discussed, the evidence for active viral infection being the driver of chronic signs is weak, which likely explains why the evidence for these treatments is also not very strong. Several antiviral options have been explored. Interferon, a protein that helps regulate the immune response, has shown activity against feline herpesvirus 1 in the lab, but clinical trials have yet to demonstrate a clear benefit in cats with rhinitis. Famciclovir is an oral antiviral drug that is virostatic, meaning it inhibits viral replication rather than killing the virus. While controlled clinical trials haven't been performed, there are reports of it helping in a couple of cases of chronic rhinosinusitis. Then there's L-lysine, an amino acid that is thought to interfere with viral replication by competing with another amino acid, arginine, which the virus needs. Some studies in experimentally infected cats showed that lysine decreased conjunctivitis and viral shedding. Unfortunately, this benefit has not been consistently demonstrated in real-world situations, such as in shelter cats with upper respiratory disease. While it might be of some use in client-owned cats who are under less stress, any potential benefit has to be weighed against the stress of administering the medication daily. Other drug classes are sometimes employed to try and manage the inflammation itself. Antihistamines have been proposed as potentially beneficial, especially if there's a suspicion of an allergic component, or if the inflammation is primarily lymphoplasmacytic or eosinophilic. However, they can have the unwanted side effect of drying out the secretions, making them even thicker and harder to clear. The response to antihistamines is very individual, so it can be worth trying different types before giving up on them. Anti-inflammatory drugs like glucocorticoids, or steroids, are a double-edged sword. They could be beneficial by reducing mucosal edema and the migration of inflammatory cells. However, there are no studies demonstrating their benefit in cats with chronic rhinosinusitis, and they could be very detrimental if there's an active bacterial infection. Furthermore, steroids are a known trigger for the recrudescence of herpesvirus infection, so they could potentially make the underlying problem worse. Nonsteroidal anti-inflammatory drugs, or NSAIDs, might be useful for reducing sinus pain, which can improve appetite and demeanor, but they don't address the inflammation itself and carry risks for cats with kidney disease or dehydration. For the most severe, refractory cases that don't respond to medical management, surgery can be an option. These are major procedures reserved for cats with a very poor quality of life. One such procedure is a turbinectomy, where the damaged turbinate bones are surgically removed. This can be done via a dorsal approach, through the top of the nose, or a ventral approach, through the roof of the mouth, which is considered more cosmetically acceptable to owners. The goal is to debride, or clean out, all the chronically infected material from the nasal cavity and the frontal sinuses. After removing the affected tissue, the ablated sinus can be packed with an autogenous fat graft taken from the cat's own body, or with a type of bone cement, which can even be infused with an antibiotic like gentamicin. While some studies have reported good outcomes, with complete resolution of signs in some cases, these are complex surgeries with significant potential complications, including surgical site infections, ongoing nasal discharge, and even death. This brings us to the prognosis. As you've probably gathered, the prognosis for chronic rhinosinusitis must be considered guarded. This is a condition that is rarely cured. The persistent nature of the clinical signs and the expense of ongoing treatment can be a huge burden for owners, and unfortunately, it can lead to some owners electing for euthanasia. The persistent inflammation can also lead to other structural problems over time, such as the development of nasal or nasopharyngeal polyps, or the formation of nasopharyngeal strictures, which is a narrowing of the back of the nasal passage. It can be a bit of a chicken and egg situation, as these structural abnormalities can also lead to the development of chronic rhinitis. Other complications can include otitis media, or middle ear infections, from the chronic obstruction of the eustachian tubes. However, the outlook isn't entirely bleak. For owners who are committed to administering medications and performing the adjunctive therapies like nebulization, the quality of life for their cat can be substantially improved, even if the condition is never fully cured. And as we've discussed, surgical management does offer the potential for a cure or at least a substantial, long-term improvement in some of the most severely affected cats. To summarize, feline chronic rhinitis is a common and complex disease, most often initiated by damage from a kittenhood feline herpesvirus infection, which then leads to a cycle of recurrent secondary bacterial infections and chronic inflammation. It presents as persistent or recurring sneezing and nasal discharge that can significantly impact a cat's quality of life. Diagnosis is a careful process of ruling out other serious conditions like cancer or fungal disease, and ultimately relies on histopathology of nasal biopsies. Management is a long-term commitment, focused on controlling symptoms with prolonged courses of antibiotics and various supportive therapies, rather than achieving a cure. While the journey can be frustrating, with dedication from both the veterinary team and the owner, many cats can be kept comfortable and happy for many years. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.